One of the times that we find that women with Fabry disease need a little extra attention is during pregnancy. Although Fabry disease has not been shown to increase the risk of complications in pregnancy, we have looked at women in pregnancy and found that during their pregnancy, they can have an increased level of pain in their hands and feet, a small fiber neuropathy. They can have increased edema, and they can have increased protein in their urine. So a woman can show up as looking as she may possibly be on the path to having more kidney problems, but we haven't found increased risk of kidney failure during pregnancy. But it is something that if you're working with women who want to become pregnant or working with an OBGYN because they are pregnant, it's important to know they can have increased proteinuria early in pregnancy, and it doesn't indicate a risk of preeclampsia or other life-threatening complications. However, just because a woman has Fabry disease doesn't mean she can't have preeclampsia or other pregnancy-related complications. So again, women with Fabry disease are complicated, but they're not too complicated for you. It is just taking a look at them objectively from head to toe and also asking them subjectively how they're feeling. If you have a woman who appears to be at risk for Fabry disease based on family history or symptoms, make sure you're ordering the right test. It's still a simple blood test or a saliva swab or a buccal swab, but you need to do a molecular genetic test that does both sequencing of the GLA gene and looking for deletions and duplications. Most often, in your more experienced laboratories, they combine both sequencing and looking for deletions and duplications within the same test, the same sample. Only by doing this molecular genetic testing can you find out if a woman really has Fabry disease or not. And again, remembering that many families have these private mutations or pathogenic variants, you may come back with a result that says it is a variant of uncertain significance or a VUS. In that case, there are some databases like ClinVar or fabrydisease.org that can help you figure out whether that mutation has been reported before, or you can discuss the mutation with a geneticist or your local Fabry center. In order to find one of those Fabry centers, you can look as closely as the National Fabry Disease Foundation Find a Provider website, which can help you look in a particular state, look in a particular region, and find somebody who's familiar with Fabry disease in your region. And that can help you kind of unwind whether or not a change in the gene causes problems, doesn't cause problems, is a known pathogenic variant, or is one that is still waiting to be discovered. One of the most interesting places we're finding this diagnosis is on a carrier testing panel. So a woman who's thinking about pregnancy or is currently pregnant, her OBGYN will often order a pan-ethnic carrier test. And in that pan-ethnic carrier test, they look through specific genes, including the GLA gene that can indicate if someone has Fabry disease. And sometimes a woman will have a surprise diagnosis of having a pathogenic variant in the GLA gene and has Fabry disease. This means that she just got diagnosed at a time when she was not looking for a diagnosis, when she was looking for the risk for her unborn baby to have an autosomal recessive condition that would be one gene change from the dad, one gene change from the mom, what's the chance they both go on and the baby has that disease. But Fabry disease is X-linked, which means it only has one gene change in a woman to cause the condition. When we think about carrier testing, though, most carrier testing laboratories, when they're doing testing for prenatal testing, they do not report out variants of uncertain significance. So just because a woman has had a negative carrier panel does not mean she does not have Fabry disease. And that's because many mutations that cause Fabry disease are family specific, and carrier labs do not report variants of uncertain significance on their testing panels. That's just policy decisions that the different testing labs decided, is that there's many genes they're testing, the chance for variants of uncertain significance is very high. And since the ultimate goal is looking at the reoccurrence risk of a condition for a baby, they're focusing on those that are known pathogenic variants and not variants that are uncertain. Women are more frequently being diagnosed with Fabry disease from these pan-ethnic carrier panels than while they're pregnant or before pregnancy. But also, these panels may miss women with Fabry disease because they don't report out variants of uncertain significance, just pathogenic variants.